Measles is a very contagious disease that can affect anybody, adults and children, but it's more so affecting children. There's usually a suspicious list of symptoms: high temperature, rash, not feeling well, loss of symptoms. But specifically there are types of rash that can be all over the body, but specifically starting behind the ear and inside the mouth. But the general viral symptoms can be there, associated with the all over the body skin rash. The MMR vaccine, the 2 doses are taken according to the advice and schedule, are expected to give a long-term immunity of an average 20 years to the vaccinated person.
So measles is a contagious infection that is caused by a virus. It can lead to things like pneumonia, which is infection in the lungs, encephalitis, which is inflammation within the brain, and can often cause a weakened immune system, which means it's more likely that you'll catch another infection. Measles can be prevented with the MMR vaccination, which is incredibly safe and effective. So we'd recommend that if you're not fully vaccinated, that you contact your GP surgery and get vaccinated.
Herd immunity is when most of the population are vaccinated or immunised against the disease, and so that disease eventually disappears. For measles, mumps and rubella, the MMR vaccine, we need 95% of the population to be immunised, and that protects the 5% of vulnerable people who have not been able to have a vaccination because of perhaps a serious allergy or treatment they're getting for a serious infection. And if we all work together to achieve this, then these illnesses, these diseases will gradually disappear. I mean, who remembers smallpox? You know, that was a killer, diphtheria, and this is down to immunisation. But we have to work together to achieve this.
So I was very fortunate enough to have my mum and my grandmother around when I had my first child, especially. Obviously, with me being a young mum, I didn't know much about immunisation and stuff. I spoke to my nan quite a lot. She had a lot of information regarding how, when she was growing up, obviously the immunisation programme wasn't out then. Children that she had known, she had seen who had developed measles, that had caused devastating effects, long-term effects. And it kind of made me realise that we are really lucky to have a vaccination programme in place.
The MMR vaccine is very safe. It's a vaccine that's been used around the world and given to millions and millions of people for many, many years. We have lots of evidence and information to support that it is very, very safe. It goes through lots of rigorous studies and testing continuously to confirm its ongoing safety.
A lot of people worry about autism linked to MMR vaccine, but actually it's one of those few things where I feel very confident in saying there is no link. So much research has been done to disprove it again and again and again. There was research published in 2014 saying that African American boys were more likely to be diagnosed with autism following the MMR vaccine. That's been redacted. It's not true at all. There's been lots of evidence to prove otherwise. And the individual who shared that information has actually been gaining a lot of money by spreading that rumour and suggesting alternative therapies.
So my son had his MMR vaccines as scheduled, but then later in life he was diagnosed with autism, and that made me go on the internet to do some research as to why he had the autism. I did a lot more research. I asked around other healthcare professionals, and with my background as well, I've come to realize that the MMR vaccine does not cause autism. It's actually safe. It's gone through years of testing, and it's been found, there are many studies to show that there is no link between autism and the MMR vaccine.
A common question we get asked about vaccines is side effects. Now, you're having 3 vaccines in one: measles, mumps and rubella. A side effect from the measles vaccine, some children, not all of them, but some children may get a measles-like rash. It's very mild and that resolves itself very, very quickly. With mumps, some children may get a little bit of swelling on their cheek or in their neck. Again, that resolves very quickly. And with rubella, some children may get some joint pain, and again, this goes very quickly. It's common after any vaccine to get a mild high temperature, and again, this goes by itself, but we'll often prescribe paracetamol to reduce any temperature.
Yeah, so in most cases, developing natural immunity through having the disease is less effective than gaining herd immunity through vaccination. Often catching measles can leave children with damaged immune systems for up to 12 to 18 months after having the disease, and can lead to more complications in the future.
Some people searching the internet may find that there's a preservative used in vaccines, some vaccines, not all, that contains mercury. There's absolutely none of this in the MMR vaccine at all. With the egg content, it's so minimal, people with egg allergies can safely have the vaccine. For anyone concerned about pork gelatin, there is a vaccine called Priorix, which does not contain any pork gelatin at all, so that is safe to take.
Vaccine confidence is understanding the information that's out there, that's trustworthy information, and feeling confident enough to carry out the vaccination with your healthcare provider. It's important to gain trust in the information, and it's important because there's many health benefits to getting vaccinated and getting your vaccinations done. It helps yourself and the community. You can build vaccine confidence by relying on trustworthy information. You can get that information from your healthcare provider, doctor, nurse, and anyone at your doctor's practice can reassure you with some reliable and trustworthy information, and that often diminishes many myths and misconceptions that's out there surrounding vaccinations.
There's lots and lots of information out there about the vaccine, but it's difficult sometimes to say what's true, what's not true, who should I trust. So speaking to your GP, the nurse, other healthcare professionals like your health visitor, the NHS website is also a brilliant source of information, and on the NHS website it signposts you to different websites that are also reputable. So vaccine confidence is important for a lot of reasons. One, that you feel confident in having the vaccine. But with this particular vaccine, it's not just about you and your family, it's about your whole community and your neighbours. We need 95% of the population to be vaccinated to keep everyone safe. And there's always a small number in that population who can't have the vaccine. And it's important we do what we can to keep them safe. As a new mum, when it's time for my little child to have the MMR vaccine when he's 12 months old, I will be absolutely going ahead to have him done because it's so important to protect him, my family, and everyone else around me.
I had 3 kids. I wouldn't have, and they were all vaccinated, and I wouldn't have considered doing anything else. And I'm now lucky enough to have 3 grandchildren, and all of them are vaccinated too. So if you have any concerns still, please get in touch with us. Our nurses and GPs will be really happy to talk to you. And please don't worry if your child's over 1 or any age. We'd be happy to vaccinate them at any time.
Getting vaccinated, in particular the MMR vaccine, is really important because it protects the patient, your child, from this illness. And sometimes if you're new to this country, or if you've been concerned in the past about misinformation and then you decide, no, I want to go ahead with this, we actually have a catch-up programme so that the full immunisation can be given. You just have to contact your GP and then appointments will be made and you can have your vaccines as normal and then get protected.